We actually already know that chronic activation of microglia has been linked to autism spectrum disorder and ADHD. And then we have NF-kappa B pathway activation. So those PSNPs, those plastic particles, have been shown to activate NF-kappa B, which is a major inflammatory signaling pathway. Overactivation of that pathway has been implicated in neuroinflammatory diseases already, and in neurodevelopmental disorders like autism and ADHD. Hi, I'm Dr. Erika Krumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole-body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started. Today, we're diving into an evolving subject that involves microplastics in the human body and bioaccumulation in the human body. Especially, we're diving into this topic of polystyrenes, that's PSNPs, and how it affects children's neurological health and behaviors. New research shows that these tiny plastic particles can actually cross the blood-brain barrier and impact the brain itself. New research also suggests that these plastic particles can impact neuroinflammation, which might be implicated in issues like ADHD and autism. So in this episode, we'll review how microplastics enter the human brain, how they're involved in neuroinflammation, how we're exposed to plastics, and the degree to which we're exposed to plastics. And then we'll also do a little bit of a pivot and talk about other interventions. So what are microplastics and how do we get exposed? Microplastics are plastic particles that are smaller than 5 millimeters, and nanoplastics are even smaller, between 1 nanometer and 1,000 nanometers. They come from food and beverage packaging, cosmetics. They come from food packaging itself, clothing made from synthetic fibers, air pollution, and household dust. Global plastic consumption is over 320 million tons each year. It's a huge amount of just waste in general in the environment. Studies show that humans consume between 40 and 52,000 plastic particles each year, and those numbers might be higher from infants that are consuming things from plastic baby bottles. The real concern here, though, is that the microplastics don't just come into the body, so we don't just excrete them through the gut like we do for our normal things. They actually cross various barriers in the human body. So it's been found not just in the brain, which is extremely concerning, and not just in other tissues, but actually within the placenta itself. So these microplastics are actually directly being passed from mom to baby. And there's some real concern that the microplastics that are in the placenta are crossing to the baby and even embedding in the brain very early, even in utero. So let's go over a couple studies here. So this all started with a 2022 study in mice. Now again, mice is not humans. That's why they followed up with a true human study. And I'll get to that in just a minute. So the mouse study did find that 50 nanometer polystyrene nanoplastics, that's abbreviated PSNPs, can penetrate the blood-brain barrier. So what they found is that not only did it cross the blood-brain barrier, but it actually increases the blood-brain barrier permeability, and that makes it easier for other toxins and other harmful substances to enter the brain itself. Once in the brain, these PSNPs actually activate the microglia. Those are the immune cells of the brain. And that led to oxidative stress, inflammatory responses, and actually eventually led to neurodegeneration in the mice. PSNPs actually disrupted the tight junctions of the blood-brain barrier, and those are really important for keeping harmful substances out of the brain. That first study suggested that even low-level exposure to those types of plastics over time, it could lead to chronic inflammation and brain dysfunction. So this was then followed up. Again, this was just released February of this year, and it was a study published in Nature Medicine that confirms that microplastics accumulate in human brains. So they used gas chromatography and mass spec, electron microscopy and infrared spectroscopy that found microplastics in the brain, liver, and kidney tissues. And these were in deceased individuals, of course. The primary plastic that was identified was polyethylene, but they did find other polymers as well. Really interesting is that the link was the strongest in patients who had other signs of neurodegeneration. So patients who had Alzheimer's disease in particular had the highest levels of these PSNPs in their brain. And then what's really interesting here too is they actually compared the levels from individuals deceased in 2016 to those in, I think, 2024, I believe, is when they finished this out. And they found increasing levels of plastics over time. That's not even that large of a gap from 2016 to 2024. So the increased levels in that time period is especially concerning when we're looking at children who are being exposed to plastics now. So we have some serious potential implications for children. If we're finding microplastics in the placenta, we are assuming that those plastics can now enter the human brain tissue. That could be implicated in a number of things, but if we're seeing these in patients with Alzheimer's as adults much older, then it's very likely that this is creating neurological inflammation in children in a very early age group. We don't have anything to confirm it at this time, but it's very suggestive that plastics are involved in neurodegenerative or neuroinflammatory conditions like the more severe types of autism or even ADHD. So let's talk about a few different things that are happening with microplastic exposure. So the immune system is being triggered, it's being stimulated as the plastics are entering the brain. The first response to that is the microglia. So the microglia are the brain's first line of defense. They're the behind the scenes, not the neurons, but the behind the scenes brain tissue, and they're supposed to protect the brain from inflammatory injury. When they're activated, they release cytokines and reactive oxygen species. They release inflammatory particles because their goal really is to protect against some kind of infection in the brain and sort of just combat that. We actually already know that chronic activation of microglia has been linked to autism spectrum disorder and ADHD. And then we have NF-kappa B pathway activation. So those PSNPs, those plastic particles, have been shown to activate NF-kappa B, which is a major inflammatory signaling pathway. Overactivation of that pathway has been implicated in neuroinflammatory diseases already and in neurodevelopmental disorders like autism and ADHD. We also know that PSNPs can trigger necroptosis, which is a type of programmed neuronal death, and that neuronal loss is associated with cognitive decline, mood disorders, and ADHD. So again, we're kind of looking at two separate things here. One is long-term issues in terms of memory, like Alzheimer's, and the other, more concerning, is early loss of neurons or loss of the linkage between neurons that could be affecting child growth. It could be affecting their learning, or it could be affecting their ability to focus and have attention. What that means is that early life exposure to microplastics, which are now ubiquitous, could have long-term neurodevelopmental consequences, and that's very concerning for me as a healthcare provider. So do we know for sure? We have no direct evidence right now that microplastics are directly involved in autism spectrum disorder or ADHD. And again, I have to reaffirm this each time when we're talking about ADHD and autism spectrum disorder. There's a lot of conversation right now that those are maybe a variation of normal neurodivergent conditions, and they can be. We all have different types of brains, and neurodivergence is not something that needs to be always treated. However, for me as a healthcare provider, I'm typically treating kids when they need to be treated. It's not kids who just think differently or are slightly different. It's kids who can't function, they can't focus in school, they can't engage with their peers, they can't have social interactions, or worse. So let's make sure that we're not, for me as a provider, I'm always careful to not over-treat things that are just a difference in humanity. But we're talking about some significant effects that is going to make it very difficult for children to function in society or to just go through school and learn normally. So the implications here are pretty vast. If we are exposing children now to microplastics in the placenta, by the placenta in utero, and we have an expected 70 years of life, they're going to have a massive cumulative chronic exposure. And that's very concerning for children, adults, and elderly. And I think we really do need a significant amount of research. There's other environmental concerns about plastic exposure anyways, whether that's microplastics or larger plastic pieces in the ocean. There's a massive amount of plastic in the ocean that can be an environmental crisis already. I'm really kind of talking about this specific piece, but For us as providers, I think we should start to educate our families on how to reduce plastic exposure. There's some very simple ways we can do that. Avoid food that is either cooked or directly wrapped in plastic. That can be hard. A lot of even fresh fruits and vegetables I find now are wrapped in plastic or are in plastic containers. Probably the ones that are directly in contact with plastics are more dangerous than, say, just a plastic holder or container, say like a berry container, I think would have less exposure than something actually cooked in plastic, but we don't totally know. Definitely recommend avoiding drinking out of plastic water bottles. There's really not much need to unless you absolutely have no access to a stainless steel water bottle. It's much better environmentally, of course, to bring our own water bottles. Stainless steel is great. Glass is great. Limiting processed and packaged foods in general, there's quite a bit of microplastics that are involved just in packaging foods and making processed foods. It's easy for small plastic pieces to become a part of packaged foods. So eating whole foods, as always, they're more nutritionally dense. They're better for us, higher in fiber, higher in phytonutrients. So that's going to be something I'll recommend to my patients anyways. Air quality is actually a big concern. I do recommend having HEPA filters in the home. Almost all areas have microplastic exposure from dust in the home. So having HEPA filters running and having HEPA filter vacuums too. So when we're vacuuming up the dust, we're not just spreading it around in the air. So some takeaways just from the microplastics piece. This is not just an environmental issue, it's actually a public health issue as well. Anyone who's concerned about children's health should be concerned about our children being exposed to plastic material. Their presence in the brain means we need urgent action and we need way more research to see. The problem is we really can't get a lot of research until an individual is deceased. There is no way of measuring microplastics in the human brain right now without doing an autopsy. So obviously that's very difficult when we don't have a lot of ability to do that kind of research. So maybe we need to develop new research to look at these plastic particles, or perhaps if there's any other way of monitoring the microglial activation in the brain or other inflammatory processes as well. Okay, I want to pivot a little bit. I am hesitant to bring this up because I want to bring this up in the context of a discussion of other things that can potentially trigger autism and ADHD in children. And particularly, I want to put it in the context of an ongoing vaccine debate. I hesitate on this because I've gotten a lot of hate mail in the past, and I would love to not have as much hate mail. But here is my frustration. There is a lot of research right now about environmental exposures and a potential link to neurodevelopmental conditions, including ADHD and autism. And I would like to say that all neurodivergence is not necessarily a bad thing. We have plenty in the world who have ADHD or who have autism spectrum disorder, and their differences can and should be celebrated in many ways. I want to reaffirm the fact that when I'm talking about these conditions, I'm talking about it to the degree that I am going to see these children in my office, which usually means they're either really struggling in school, they're struggling socially, their symptoms are severe enough that it's really interfering with their ability to have a happy, healthy, functioning childhood and even potentially grown-up life. So those are the times that we sort of more intervene. We give kids support for anxiety, for focus, for all these things. The reason I want to circle back is I persistently hear only, I feel like, conversations about vaccines and autism, vaccines and autism, vaccines and autism. And I find it very frustrating when we have stronger research, not in the vaccine world, that just consistently gets ignored. Here we have some microplastics. This is early suggestive research that's not super strong yet. I want to be really clear with my viewers, and I try to be very clear with my patients too. When we have clear science, negative science, or positive science, I'm not in it for any outcome. I'm not being paid by anyone at all for any of this conversation. So I'm really honest with my patients, especially in terms of risks and benefits of things like vaccines. Just for an example, other very positive studies we have for neurodevelopmental issues in children, there's quite a bit of research in terms of phthalates, and phthalates maybe directly being a link, environmental link to increased rates of autism and ADHD in children. Other very strong links are maternal and paternal age. So the age of mom and dad are pretty much directly linked to rates of autism in children. Others are air pollution in general. Children who are exposed to more of those very fine particulates have higher rates of autism. Very strong research into flame retardants. Children who are exposed to flame retardants have much higher rates of autism. And those flame retardants are on children's pajamas. That's been something I've been talking about for years, and it gets no attention whatsoever. Those are very easy ways we can reduce risk. I know I have talked with families forever about autism and Tylenol. That's also called paracetamol or acetaminophen. So when we kind of take a step back, I've had many conversations with my patients and other patients about this larger autism debate, especially in terms of vaccines. Right now, at least in terms of MMR, the MMR vaccine that has been, quote, blamed on autism has been studied in massive amounts. So tens of millions of children they have studied and have found no association between the MMR vaccine and autism. There have been other studies on other vaccines and other vaccine schedules in autism as well. Not all of them have been as robust as the MMR vaccine. I also want to say this because recently there was a new study out that did show an association of just general vaccine exposure and children with autism. But I do want to state that that was not a great study. So that study was put out, the top researcher was a well-known vaccine, like a strong vaccine opponent. And I always want to tell families, if you're looking for something specifically in data, you can find it. And that could be on either side here. So if you're looking for vaccines to not cause autism, that's what you can find. And if you're looking for vaccines to cause autism, there's probably a way to find it. So I'll backtrack a little bit and explain a little bit more. But the study that found that vaccines cause autism was just a review of patient records. So it basically was reviewing what their diagnosis was and whether or not they had vaccines at that visit. But that ignores, whether the child was vaccinated before, at a different visit. It really isn't the best way to study that. So in contrast to that, in the study of MMR and children with MMR, they were actually looking to see if there was an association between the MMR vaccine and autism. And they even compared, the thought was like, well, maybe it's just children that are at higher risk that are exposed to the MMR vaccine, then maybe they have a higher chance of autism. So they studied siblings of kids who are already autistic and also found no association. So I have no agenda here. I want what's best for my families and my practice. If that's all vaccines or no vaccines, I want to educate them on what's best. The concerning thing right now is here in Missoula County, we're in the middle of a pertussis outbreak. And I know West Texas is currently in the middle of a measles outbreak. And that concerns me. My primary objective is the best outcomes for all my patients. I personally vaccinate patients. I vaccinate a lot of patients. And I have extremely low rates of autism and ADHD in my practice. Children that I've known from birth, where I was their primary care physician from birth, I have 0 that have level 2 or level 3 autism. I do have some that are level 1 autism. Those kids are super bright. The majority of them have intelligence ranges in the 99th plus percentile. So again, this is neurodivergence in population. So the reason I want to have this conversation is that I do think that we should continue to study the safety of vaccines. I really think we should look at each vaccine individually, but I would love it if we started to have a conversation beyond vaccines, because right now the evidence is much clearer that other environmental pollutants are a bigger cause, at least, in triggering or causing autism than vaccinations. The other thing that I want to mention again, and I have said this I don't know how many times, is that link with acetaminophen or Tylenol. When they have studied vaccines, they've studied vaccines in autism, they have removed the Tylenol piece. Children at 12 months of age who typically receive the MMR vaccine usually receive more than the MMR vaccine. They usually get MMR, varicella, Hib, pneumococcal, and hepatitis A all at once. The studies show that when we combine the MMR vaccine with the varicella vaccine, it doubles the risk of febrile seizures in kids. A lot of those children who are having fevers and rashes are then getting Tylenol. And in fact, the studies have shown that when children have MMR plus Tylenol, those children do have a higher likelihood of autism. So it's time to look past just the vaccines, at least when we see strong data that suggests that vaccines, at least the MMR vaccine, is not directly implicated in autism. It might be something else. I've been warning parents and providers too about the dangers of Tylenol for over 10 years. The research is becoming more and more and more strong that children who are exposed to Tylenol, especially in utero, have higher rates of autism and ADHD. We know that Tylenol directly depletes glutathione. Glutathione is one of the body's main endogenous antioxidants, and it's one of the few antioxidants that does cross the blood-brain barrier. So it's very important in reducing inflammation in the brain, and it's very important in the first year of life as well. So, moral of the story is absolutely avoid the combination of vaccinations plus acetaminophen. I really want to see more research in terms of environmental exposures, and I really want to see a conversation move past, is it vaccines, is it not vaccines? And please, let's talk about more the exposures that children are having in our environment, in our food supply, in so many places, in their clothing, in their crib that has phthalates. These are really concerning to me, and I want to give my parents in my practice the best advice in terms of how to prevent these neurodevelopmental disorders for their children. So I'm sure I'm going to get hate mail from that one. Sure, because I always do. If you have constructive criticism, go for it. If you want to send me hate mail, I would prefer if you would avoid it. That would be lovely. Let me know your thoughts in terms of all of these. I'm open to suggestion, and I'm always open to learning. But right now, that's where the evidence stands. So take care as always, and I'll bring you some new research next week.